Welcome to Diabetes Made Simple, Maher's Journey. This is Dr. Akhil Farooq, pediatric endocrinologist. When families first hear the diagnosis, one of the biggest questions they ask is, why does my child need to take insulin when I know adults are taking tablets? To understand this, it helps to look at the two main types of diabetes. In type 1 diabetes, which affects mainly children and young adults, the immune system mistakenly attacks the insulin-making cells in the pancreas. So the body makes very little or no insulin at all. This is not caused by eating too much sugar, weight issues, lifestyle, or anything that the family has done. That is why insulin through injections or a pump is essential from the very beginning. Tablets cannot replace insulin in type 1 because the pancreas simply cannot respond to them. In type 2 diabetes, usually in adults, sometimes because of being overweight or age, and sometimes in older teens, the body still makes insulin, but the insulin does not work properly. This is called insulin resistance. The pancreas is still active, just under pressure. Treatment may include tablets, better nutrition, losing weight, exercise, and sometimes they too need insulin. This is very different from type 1.
Nurse Noor, my grandmother has diabetes too. She takes one injection a week and doesn't check her sugar all the time. Why is mine different?
She has type 2 diabetes. It can often be managed with tablets or weekly injections and fewer glucose checks. Like most children, you have type 1 diabetes, which means you need insulin every day, and a closer eye on your glucose levels throughout the day to help you feel well.
Put it simply, think of your pancreas like a bakery that makes insulin instead of bread. In type 2 diabetes, the baker is making insulin, but he has many orders and is tired. Therefore, tablets, activity, and lifestyle changes can help the baker keep up because he's still able to make insulin, but just not enough. But in type 1 diabetes, the situation is very different. The baker is missing, so the bakery cannot make insulin anymore, and you must get your insulin from somewhere else, injections or pumps. Understanding this difference helps families focus on what their child actually needs. In the next episode, we'll talk about the 4 T's, the early signs of type 1 diabetes, and how to recognize them early.